Good evening, everyone. That's the microphone. Oh, thank you. I've never actually heard anyone say good evening before. I love it. Thank you. I'm going to make that a regular thing. Thank you so much for joining us here at 180 this evening. It's amazing to have so many of you with us. I am Francesca Ogiman-White and I'm the founder of the Beauty Triangle. Now, June, as I'm sure many of you are aware, is Acne Awareness Month, which is very much on the catalyst for tonight's conversation. I think we can all agree that when our skin is playing up, our self-esteem can really plummet. And I think the point of tonight's conversation is really to understand how we can better manage breakouts, how we can deal with the scarring that sometimes acne leaves behind, but also more importantly, how we can really reinstate lost confidence in our complexions. Now, many of you have been to our talks before, so you'll already know this. But when we started the Beauty Triangle, it was to educate and empower our audiences on all aspects of their health and well-being, and always critically from a holistic standpoint, which is why you'll always find three incredible experts on our panels, each of whom is an absolute authority in their given area of expertise. But we also wanted to have the conversations that no one was having, and to have them in collaboration with some of the most trusted voices in the world of wellness, which very neatly brings me on to our incredible panelists that we have with us tonight. I'm joined by consultant dermatologist and founder of Self-London Clinic, Dr. Anjali Mahto. I'm also joined by aesthetic doctor and founder of the Dr. Anna Skin Clinic in Birmingham, Dr. Ana Mansouri. And finally, consultant dietitian and founder of City Dietitians, Sophie Medlin. And really, they are all here, these incredible women, to help us get our skin back under control, whether that's through topical ingredients, solutions, whether it's through the latest high-tech treatments, or even the power of probiotics, supplementation, and anything else really lifestyle-wise that we need to be implementing to really get our skin back on an even keel. You should all have found a program on your seats. There's a little handy note-taking section. You'll have found a pencil as well, so any inspiration, any tips and tricks you pick up from our panelists, you can scribble them down. There's also a referral card on the back, so if you'd like us to connect you with anyone that you hear speak tonight, you can just leave your email address, tick the box next to their name, and we'll do all of that for you. We'll have an audience Q&A at the end, so if you've got any questions, please save them up until then. And we have a fantastic goodie bag for everyone here tonight. We've got skincare from Cetaphil, from Purified, from La Mer, and we also have some amazing supplements from You're Looking Well, which is a beautiful brand. They're actually stocked here at 180 Health Club as well. That's enough speaking from me. I'm going to pass over to our speakers to introduce themselves, and then we'll get started with the main conversation. So Anjali, maybe you can kick us off.
So I'm Anjali Mahto, I'm a dermatologist and I am founder of a clinic called Self-London. I wrote a book called The Skincare Bible about 5 years ago now, I think, and that has now been translated to about 11 or 12 different languages. Qualified yoga teacher, have a diploma in nutrition, but really acne and acne scarring is the big thing that I do.
Thanks, Anjali. Anna.
Thank you. So my name is Ana Mansouri. I'm a GP by background, and with a special interest in cosmetic dermatology. So I'm a trainer and injector, and have recently founded Dr. Anna Skin Clinic, which is the first UK SkinCeuticals flagship clinic in Birmingham and Charleston. But really my passion lies in, apart from cosmetic dermatology, the integrated approach, so combinations of in-clinic modalities to optimize our outcomes alongside skincare. So that goes all hand in hand with the less is more approach and then getting better results overall.
That's a nice philosophy. Thanks, Anna. Sophie.
Hi everyone, my name is Sophie Medlin. I'm a consultant colorectal dietitian, which means I'm probably the least glamorous of everyone on the panel because I talk about butts and guts for a living, which I love. And the reason I got into that is because we can make such a big difference to people who live with gut health conditions through diet and nutrition. I've been a dietitian for 18 years. And I've seen the world of nutrition change dramatically in that time, and we could never encourage people to eat kale, and then social media came along and everyone's eating kale, right? So there's been so many changes over the years in my space. I run a clinic called City Dietitians. We've got a team of 15 dietitians, all with their own highly specialist area of clinical practice. I also am lucky enough to formulate nutritional supplement products for You're Looking Well, which I'll talk a bit about later, as well as other companies. And one of the areas of interest and practice is really coming up recently is this gut-skin axis conversation, and I'd love to share a bit about that with you today.
Thanks so much, Sophie. Fantastic introduction, so I feel like I learned something new about all of you on that, so that was definitely hitting the brief. So we'll get started with the main conversation, and our first speaker is Dr. Anjali Mahto. So she's already introduced herself, but I suppose by way of my own personal introduction, Anjali and I have known one another for, like 10 years, 12 years or
10
something.
years,
I
10
like to
years.
show my age when I say things like this, but I think you're very much, you have always been my sort of first port of call when it comes to things that are very acne focused, really sort of trying to get to the root of all things breakout related. So I'm delighted to have you here for today's talk. But maybe before we start looking at ways to manage breakouts, can we touch a little bit on the emotional connotations of acne and how you see that, I suppose, psychologically impacting on your patients?
Yeah, I think it's really interesting that we still underestimate the amount that skin conditions, any visible skin conditions, particularly ones that affect your face when we're interacting with others, can impact your self-esteem and your self-confidence. And acne is probably one of the most common skin conditions. About 85% of people will suffer with acne at some point in time. And we know the face, the back, the chest are commonly affected sites. So it's not surprising that you're going to get issues with self-confidence, low self-esteem. But actually at the other extreme of that, social anxiety, and potentially even depression, and even risk of suicide. So it's not to be underestimated.
100%. I think we're living in such a visual society now as well. We're all on our phones all the time. We're so driven by what's going on social media, and we're constantly seeing sort of images of skin, perfect skin, imperfect skin. And I think that can really sort of add fuel to the fire, can't it?
I think it can. I mean, gone are the days where you used to compare yourself to the other kids in your class if you're an adolescent and you're breaking out. Now you can compare yourself to literally anyone in the world on social media.
Yeah.
And I think when you are a teenager, you don't necessarily have the wherewithal to recognise that all of these are filters. This is not what real skin looks like. So I think we're living in a time where skin conditions, not only do they come with our self-esteem, but they're being compounded by the fact that social media is driving us to actually not realise that skin conditions are normal. Skin has pores. Most teenagers will go through acne. This is normal. So it's a huge issue.
Yeah, we definitely need to step away from the sort of filtered airbrush sort of, idealized perfection of what skin should look like, and actually celebrate skin for actually what it is for all of us as individuals. Sometimes good, sometimes bad, and sometimes a lot of things in between.
That's right. It's funny, when people are on their skin journey, when skin gets better, usually people are really excited and they're really happy that they can see their skin improve. But you know that you've got patients to a really good place where they're not happy or sad. Their skin just is, and they don't really think about it anymore. They can fall out of bed, and it's a bit like, I don't know, breathing. You're not thinking about breathing. Your lungs are just doing what they need to do. And really, that's where we want to be with our skin as well. It's not good or bad. There's no emotional connotation to it. It should just be there.
We don't want it to take up as much headspace, I suppose, as it probably could do otherwise. And it's interesting because I think more and more we're talking about the fact that acne breakouts are affecting men, women at all stages of life, whereas I think once upon a time it was very much the domain of the prepubescent, the teenager, the adolescents, it's the children, it's the kids. But actually, we're seeing sort of hormonal sort of breakouts, we're seeing skin flare up at multiple chapters throughout life now, aren't we?
That's exactly right. I mean, acne is not a teenage condition. Yes, it develops in adolescence due to the change in hormones that we see, but in actual fact, it's there at every decade. If you're going through hormonal changes, pregnancy, perimenopause, menopause, taking HRT, egg freezing, getting hormones as a result of that. So it's nearly every single decade of life until you're properly through the menopause that acne settles down.
It's those body chemicals, isn't it? Sort of getting sort of involved in all of these sort of areas that are really triggering the flare-ups. What about sort of the acne sufferers, whether they are old or young, I suppose? What are the first steps that we should really be taking when it comes to getting acne under control?
So I think most people's journey probably won't end up going straight to their GP or a dermatologist like myself. What will usually happen is people will be at home and they will be trying out different skincare products. So facial moisturizers, cleansers, toners. So I'd say a good start point is a good skincare routine. So using ingredients like salicylic acid of up to 2%, using ingredients like benzoyl peroxide, like niacinamide, all of those can help as part of a good skincare routine. In addition to that, though, it's also really important to wear sunscreen. Yes, I'm a dermatologist, of course I'm going to say that, but the truth is that the sunscreen use will reduce the risk of hyperpigmentation, so dark marks after acne, or the red marks, post-inflammatory erythema that you can get. But if you've tried a good skincare routine and you've gone through that skincare routine for about 6 to 12 weeks, and your acne is getting no better, or it's getting worse, or it's becoming more extensive, so it's starting to affect multiple body sites, or it's starting to affect your mental health and your day-to-day, or you are starting to get scarring, all of those should be triggers that you actually should be looking for medical attention at that point in time. So this is really where you would go to either your GP or a dermatologist, who would then potentially look at prescription creams, tablets, or in a dermatologist practice, potentially using peels, lasers, or oral medication.
And I think actually it's interesting because we were talking about this before the talk, you and I sort of offline, and saying actually it's almost a duty of care to those that you see, maybe it is the teenagers, maybe it is friends, but actually saying, before this gets worse, like it can feel like a difficult conversation to have with somebody, but I think maybe it is something that we need to try and destigmatise, talk about a little bit more so that people understand there are solutions and they don't have to suffer in silence.
I think that's absolutely right. I mean, one of the questions I like to ask in clinic is, on a scale of 1 to 10, 10 being the absolute happiest you could be with your skin, when you woke up this morning and you were getting ready and you looked in the mirror and you saw yourself, how satisfied are you with your skin? 10 being the best, 1 being the worst. And often that number really gives away how people really feel about their skin.
That's so interesting, isn't it? Who do you see as your sort of average patient coming in for acne management?
Honestly, it's a really mixed bag because we see a lot of acne in the clinic. So I would say, we see teenagers, preteens, but beyond that, there's a huge cohort of female adult acne sufferers. Often women that have been on the pill for about a decade. They put on it in their teenage years, they get to their mid-20s, they have no idea what their normal cycles are like. They want to come off, but the pill has been suppressing their acne. The minute they come off it, their acne flares up.
And then you end up with people who are sort of so scared almost to go off the pill. I've had friends who are sort of like saying, I have to be on this pill because it's the only thing that controls my skin. They come off it, they flare up, and you can feel chained almost to a contraception in that sense.
That's exactly right. And I think there's almost a double issue there. It's not knowing what your acne is going to do, but in addition to that, having no idea what your normal cycles are like either. I think both of that with itself brings stress and anxiety.
No, so true. And tell us a little bit about AviClear. So this is the latest device, I think, to land in your clinic, and it's a bit of a game changer when it comes to, I suppose, managing active acne. Well, in fact, acne at all levels, but can you tell us a little bit about it and exactly how it works? It's really interesting.
Yeah, I mean, I've got to be honest, it's probably the most exciting thing to happen in the world of acne, probably since the early 1980s, when isotretinoin or Roaccutane was the main drug that we used for very severe or nodular cystic acne, so those deep red bumps. So AviClear is a laser that uses a very specific wavelength of light. So generally speaking, the way that lasers work is they see things in the skin. So some lasers will see red, so they'll target blood vessels. Some lasers will see brown, so they'll target pigment. But what AviClear does is it uses a wavelength of light that sees sebum, so it sees oil. And what it will do is it will see that oil gland and it will shrink that oil gland down. If your oil gland is smaller, it's chucking out less oil onto the surface of the skin, which means your pores don't get blocked. And if your pores don't get blocked, then the bugs that live on your skin have got nothing to act on to create those deeper inflammatory spots that can lead to scarring.
That's so interesting. So it's literally going straight to the root cause of the problem and actually shrinking those. I think you actually described it as the factories almost, like those little oil glands that produce all of the oil in the skin.
That's right, because the main issue with acne is that oil gland not working properly, so it's sebaceous gland dysfunction. So what we're doing is that's exactly what we're targeting. Now, in the past, there have been lasers that have been used for acne, but the difficulty with those lasers was, first of all, they didn't give any long-term results, where AviClear's results seem to last up to 2 years and beyond. The second thing is, most of the lasers that existed, they have not been suitable for all skin types, so from the lightest of light to the darkest of dark skin. And the other thing is, most lasers that are out there also cannot treat acne of all severities. So mild, moderate, but even severe acne, where previously your only other option would have been oral medication.
Exactly, and not everybody wants to go on the oral medication. So that can also come with its own entire side profile, which I think isotretinoin can be an absolute game changer for some people, but obviously it's not suitable for all of your patients. And it's amazing to have a drug-free solution to managing acne now.
That's exactly right. I mean, there are a lot of people that can't take oral medications, don't want to take oral medications. There are also changes that happen as one gets older. So, other kind of health issues, other comorbidities, problems with, let's say, cholesterol going up, which can happen very commonly to women after the menopause. In that situation, you may not want to prescribe isotretinoin, and you might want a drug-free approach. So it's really nice to have an additional option that is so effective for all acne types.
And do you mind me saying, you've actually tried this yourself, haven't you? You've been a bit of a guinea pig, which is amazing. I have to say your skin is looking completely flawless from where I'm sat. So how far along the course of treatment are you?
Yeah, so for those of you that don't know, I'm a long-term acne sufferer. So I'm in my mid-40s now, and I've had acne since I was about 12. And all the treatments that I've talked about, I have had at some point in time. Isotretinoins, spironolactone, the pill, the topicals, other lasers, you name it, I've had it. So I'm currently 2/3 of the way along my course of AviClear. So it's 3 treatments, carried out about 3 to 4 weeks apart. Mm-hmm. And I've had 2 sessions. I'm due my 3rd one in the next week or so. And so far, so good. I mean, personally, I've not had any breakouts since I've started the treatment.
That's incredible. Are you doing anything else alongside it?
I'm a terrible dermatologist who doesn't use very much skincare, to be totally honest. I keep my skincare very simple, so I'm not doing much else. But from a practical kind of point of view, from the patient perspective, we've had lots of patients in clinic come through as well. And actually the results are fantastic. To be able to clear, certainly with the severe nodular, cystic, deep acne types, to not have to use oral medication is pretty impressive.
And when do you start seeing those results? Like how long until visibly you can notice an improvement in the skin?
So it's variable. The results will get better as time goes on, but the truth is that's the case with any acne treatment. Nothing works immediately.
Yep.
Generally speaking, your skin has to go through a couple of skin cycles before you will notice any benefit. And that's why most acne trials, regardless of what they're for, they run for a minimum of 12 weeks. So with AviClear, what you tend to find are roughly about 30% of people will be clear at about 3 months, 60% at about 6 months, 90% at about 9 months. But that clearance lasts 2 years onwards from the data that we've got.
And what's so nice is that it's gradually building up that confidence as well. And I think there's a lot that can be missed through acne. People cancel social engagements. They don't do meetings. They sort of hide their face behind their hair. They avoid photographs. They avoid social media. I mean, all of these things. I think if we can empower ourselves to the right treatments, we can actually start to change actually what our life looks like.
Absolutely, and I think that's the key thing. We want to get people to a point where you've treated their acne before they develop their scarring, because the scarring comes with its own issues and its own concerns. It's also much harder to treat scarring than it is the acne itself. So I think that if we can catch people early, treat them early, you prevent the long-term mental health effects, but also the physical effects that acne itself will cause.
And Tommy, is it uncomfortable in any way?
So, on a scale of 1 to 10, 10, I like these scales, 10 being the worst treatment or the most painful treatment that you can imagine, for me it was about 2 or a 3.
That's amazing.
Yes, it was actually really comfortable, to be totally honest. It was most uncomfortable in kind of like the bony areas, so around the temples, and then a little bit on the chin, but it was very, very tolerable.
Interesting, so no numbing cream?
No numbing cream.
Yeah, fantastic. I mean, it definitely sounds like something that I think is going to be absolutely flying at your clinic.
We are using a lot of AviClear. A lot of people don't want to take medications or would prefer to try an option before they end up, particularly down the isotretinoin or Accutane route.
Is there anyone that it's not suitable for?
I mean, technically speaking, I guess you don't do trials in pregnant women, so you may want to think twice about pregnancy. In actual fact, though, lasers are used in gynecology, so from a logical perspective, I would personally have no issues treating somebody in their 2nd or 3rd trimester of pregnancy.
That's really interesting. I mean, God, trying to get people to say, yes, I'll touch a pregnant woman is a mean feat. I could barely get a massage when I was pregnant. And I know I asked you if you're doing it in combination with any other treatments, but what do you find best effects are gained from when you are actually sort of treatment layering AviClear with other things?
Yeah, so I think you've got to combine it firstly with a decent skincare routine and that sunscreen. There's a certain number of people, any acne treatment that you start, you can get an initial purging or flaring of acne. So I think if somebody is very, very anxious or worried about that, I may offer, and this is probably the only condition where I do use antibiotics, but a short course of antibiotics.
You're not a fan of antibiotics because of the
gut health issues, long-term resistance, so they're not my preferred treatment. If somebody's got polycystic ovarian syndrome or PCOS and there is a hormonal drive to their acne, I may combine it with an oral medication called spironolactone. So a lot of that then just does come down to the individual and their personal circumstances, and also how they feel about if they have a bit of a flare or if they don't.
Yeah. I think that's such a nice thing to end on, because actually all of this comes down to the bespoke approach, doesn't it? You've got to look at the patient in front of you, have that conversation, have that communication, and figure out what journey looks right for them.
Absolutely.
Amazing. Well, thank you so much, Anjali. That was fascinating, as always. And our next speaker is the amazing Dr. Ana Mansouri. Thank you very much for being here, Ana.
Thanks for having me.
Ana's already introduced herself, but she is a fabulous injector, and yes, your clinic, which you mentioned, the first ever SkinCeuticals flagship is actually quite spectacular. It is a thing of beauty, so it's definitely a reason to leave London and go down to Birmingham. But tell us, I mean, we touched very briefly on sort of topical skincare and what you recommend and what you're doing in clinic, but when you see somebody who's really struggling with oiliness, congestion, the breakouts are a concern, what are the things that you're trying to get into their routines? And I suppose, what are you also trying to eliminate?
Yeah, so skincare topically is always the first point of call in terms of the patient journey when someone comes into clinic. And when it comes to topical ingredients, we've got the prescription and then the non-prescription options. So when it comes to non-prescriptions, as mentioned already, we've got salicylic acids, which are the sort of oil-loving acids that help with chemical exfoliation. We've got benzoyl peroxides that help to almost kind of dry out the inflammatory active spots. And we've got other ingredients such as azelaic acids that can be helpful. Niacinamide, soothing type of the chemicals that help calm down inflammation. And then of course we've got the prescription grade, which is a big part of what I would do in clinic, where we would use retinoic acid, so prescription strength retinoids. And I find that's really helpful, in particular for long-term maintenance. But that would, of course, be under the guidance of the prescriber because of these sort of somewhat challenging adjustment periods. But for me and my patients, that's been really transformative.
And when you say challenging adjustment periods, do you mean the skin sort of just going into a bit of a meltdown, flaking off, peeling off?
Yeah, I mean, we call it sort of retinoid dermatitis, or it's depending on how your tolerance, but also the approach. We tend to start very gently to minimize that. So if we're talking irritation, slight redness, a little bit of flaking and peeling, but with the right protocol and guidance, we can keep that very mild, especially when we're looking at mild to moderate acne with no risk or new scarring. We don't have to rush to torture the patient through that. So we take our time.
Torture free, please.
Exactly. So we do take our time, and it doesn't have to be so scary as it sounds.
And what are the ingredients you see? I don't know if you see patients bringing in their skincare and their products. Are there things that they tell you, and you just go, absolutely not. That's the last thing you should be using when you're having breakouts. I remember in lockdown, everyone was suddenly, pretending like they were a mini dermatologist and throwing all these things at their faces. So what are the things that you come up against in clinic?
A lot of the time we see the latest TikTok trend, which can be very unhelpful and counterproductive. But then we've got
sets you back a few skin cycles, trying to repair that.
Exactly, and then often they will come in from that with a compromised skin barrier. So actually, we then start with repairing the barrier before we even start the actives.
The skin barrier disruption is a huge thing at the moment. I'm sure you probably see this as well as a derm. Everyone just throwing everything,
exactly, overexfoliating, overusing whatever they've seen, and then we're dealing with a compensatory reaction where we get overproduction of sebum, or we get irritation, worsening acne. So it's all just an evil cycle.
Got to give everyone very strict talking to when they come in.
Exactly. So then we start off with repairing the barrier if that's an issue. But often we see the classical sort of overwashing, using hot water, using quite harsh ingredients, over-exfoliating, scrubbing, so being too harsh, whether it's chemical or mechanical exfoliation, again, compromising the barrier. And then the last one is, of course, the comedogenic type of ingredients. They might be using oils that aren't helpful. It might actually be an issue with whatever scalp product they're using.
So that's another huge trend. Obviously, everyone's saying treat your scalp like you do the skin on your face, which is great as long as it's not compromising the skin on your face.
Exactly. So then we kind of break it all down, try and find any comedogenic factors, any sort of occlusives, etc., and work from there.
Gosh, I mean, it goes to show again why you need a partnership with a good doctor who can actually demystify a lot of this stuff for you, because the average consumer just watching TikTok probably wouldn't necessarily have a clue. For those who are experiencing sort of more oil and congestion versus active acne, what are the in-clinic treatments that are your sort of first port of call?
Yeah, so in terms of mild to moderate acne, we've got our skincare routine. I do find that we get much better results if we go with a combination approach. So we have our patient journey where we'll move through in a bespoke manner. Our most popular option for this in clinic is hydrofacial.
Hydrofacial.
Yeah, and of course this can be body or face. Now, the way I think about hydrofacial is that it's a somewhat more sort of medical approach to a facial, where you've got your physical and chemical exfoliation, you've got your hydration, but you've also got more personalizations and boosters. But there is actually some really interesting, relatively recent data on how hydrofacial is very helpful for acne in particular.
Really? Like what? Because I always think about exactly the sort of body hydrofacials, like the back and the chest, and every time somebody's getting married and they're wearing a backless dress and they come to me like, where can I go to get back facial? And hydrofacial is actually really great for that, that sort of hands-free approach, all of like you say, the bespoke serums and boosters.
Yeah, I mean, from one point of view, hydrofacial is part treat, but definitely also part treatment. I think it's somewhat overlooked what the medical benefits are. So for instance, the study, they looked at over 12 weeks in a multi-center setting at 20 patients with mild to moderate acne who had 6 hydrofacials. And they found a significant improvement in the severity of the acne, which was based on the global acne severity assessment score.
Wow.
And
it's funny because I would have shied away from something like a hydrofacial, thinking there's a lot of very powerful exfoliation going on.
There is, but you can also personalize it. So they've even got new, even more gentle peels coming out. And because, I mean, with any device, it's almost like the treatment is only as good as the operator as well. So it does come down to clinical judgment and how you utilize that modality. But even more interestingly, 100% of those subjects reported a significant improvement in their confidence levels after these 6 hydrofacials.
That's amazing.
So I think that's really, impressive. And then there's the boosters, the wet diamond. There's so much more to it now. So.
And you mentioned sort of lighter chemical peels, and what about the sort of field of chemical peels? Is that something that's really sort of beneficial for patients that you see who are suffering with breakouts and congestion?
Yeah, definitely, especially if it is more comedonal, so whiteheads, blackheads, oily, congested skin. If they don't mind the downtime, we go down the route of, for example, a TCA peel or a retinoid and salicylic acid-based peel. And we often combine that with LED light therapy. So, for instance, blue light, which is great for active acne, but also for more oily or congested skin types to suppress the bacteria, but also the oil production. Sometimes we combine that with red and near infrared lights as well. So those are really good combination protocols.
And what about what happens when the acne is under control? Because Anjali mentioned the scarring, and I think that's always at the back of the acne sufferer's mind to try and get ahead of the scarring. Is there anything that you can do in clinic when somebody really sort of has left it a bit, and they've got the scarring as a result of the breakouts? Like what can you do to soften its appearance?
Yeah, I mean, acne scarring is just so challenging, and it is the most challenging, I would probably say that someone like myself would see in the cosmetic clinic setting, and it's so significantly affecting most of those patients' quality of life. Now, the way that I think of the options is as a step-up ladder, and it's almost somewhat of a cumulative effect. The more we put into it, the more we get out of it. The more intense the treatment modality is, as long as it's safe, the better the result may be. But we also have to be realistic. For someone like me as a medical practitioner, even a 30% improvement or 50% improvement in acne scarring is a great win. And that is often enough to really improve confidence levels.
What's your sort of first line defense treatment when you do see a patient who's presented with scarring? What would you be using?
Yeah, so it can be anywhere on the scale of something more gentle like microneedling, or something kind of the next step up. We're talking RF microneedling, so combining heat with the needling, or even ablative lasers. Like
so all things that will, sorry, just to interrupt, but so things that are really sort of plumping up the skin and sort of trying to cause that trauma and regenerate
exactly.
it.
So it's all about this idea of controlled microtrauma. So for instance, with the heat and the needles, we're creating trauma, which then almost triggers the body into healing that, in which case every time or after every session, we create a little bit more collagen and we get a smoother complexion, a smoother surface each time.
And there's really interesting data, in fact, to show that some injectable products as well are really beneficial for scarring. Am I right? Sort of like skin boosters and...
Definitely. So this is something I'm very excited about, and I'll be doing more and more of going forward. So, for instance, the Restylane Vital Skin Booster has great evidence in terms of clinical trials showing a significant improvement in not only just the skin condition, radiance, hydration, but also the level of smoothness, the texture, and specifically also for acne scarring.
That's really interesting. I feel like there are so many skin boosters out there, and sometimes patients get so overwhelmed and confused by what the options are. But I think anyone who's obviously sort of suffered a breakout and who is concerned by scarring, that's really valuable to know that that's a key sort of feature of that one.
Definitely. So what we do in clinic is we will combine, for example, some subcision with a cannula with the skin booster, the Restylane Vital, which is my first point of call. So whenever it comes specifically to acne scarring, that would be the skin booster of choice in terms of the evidence base. And I've seen some great results, specifically from colleagues who have been using it for many years, very impressive results.
That's really interesting. And so to touch a little bit more on the injectable work that you do, because I think there's no question about it, our skin and our self-esteem are very intricately linked. What can you do with your sort of portfolio of injectable products to really enhance that self-confidence in the patient who might sort of not be feeling 100%?
Yeah, so of course, injectables for me, it is more about restoration of confidence or turning back time rather than changing or augmenting patients, taking that really holistic, light-handed approach of replacing volume loss. So for instance, we might have patients with acne or acne scarring, but they may also feel like the signs of aging are affecting their confidence. So that all goes hand in hand in them feeling most comfortable in their skin and feeling like they look on the outside as young as they feel on the inside. And really the approach for that, in my opinion, the best way is the listen and often approach. So perhaps only using 1 or 2 milliliters of very strategically scattered fillers, my preference being the Restylane portfolio, whether it be for folds or lines or volume loss in the mid-face. And that just goes really nicely hand in hand with this long-term improvement, say over 12 months, in a very tasteful and undetectable manner, turning back time from an aging point of view, as well as supporting their skin health from a topical and sort of multimodality device point of view.
I think it's a really interesting point because, as I was saying with Anjali at the very beginning, acne isn't just affecting teenagers, it is women at all and men at all ages and stages of life. And actually, I think as much as we want to get to grips with acne, there will be other things going on as well that will also be bothering us. So it's almost important to take that layered approach to the skin.
Really, in the setting that I'm in, because we are a cosmetic clinic, we don't actually see under 18, so we rarely see under 21. So for me, it is predominantly adult acne, and there's most of the time there will be an element of aging that goes hand in hand with that.
Yeah, 100%. And just to sort of cap on the sort of injectables conversation, there's a huge sort of resurge in collagen stimulators, right, like sculpture and things. And again, for that slightly more mature patient, I guess that can be a little bit of a game changer when it comes to really getting the skin back under control and boosting the confidence.
Definitely. I think sculpture is, although it's been around for over 20 years and it's so well trialed and tested and well known, I think it has been somewhat overlooked over the last few years, especially now with regenerative aesthetic medicine becoming so relevant, and I really think that is the future of our industry. I am so interested in how I can implement Sculptra into all my treatment plans for that very subtle and natural collagen stimulation But I've started also to think more about how we should really be implementing this a little bit earlier.
Mm-hmm.
So even in our early 30s, because really what we'll get out of a collagen stimulation treatment in our early 30s will be so much more powerful than if we were to leave it until perimenopause or during menopause.
Where it's really depleted and we've got quite a lot to build up. I mean, that's where the whole term collagen banking came from, right?
Exactly.
You really look after those reserves, the stores that you have in earlier life.
Definitely, and we won't need as much product. It'll be less of an undertaking, yet we get a much bigger response. It all goes into the collagen bank, and I think that preventative approach is so valuable. So that's how we're tying it all in together in our patient journey.
Amazing. It sounds like an incredible patient journey. I need to come down and be guinea pig for this patient journey. Thank you so much, Anna. That was really interesting to understand how the sort of cosmetic, aesthetic side sort of supports breakouts as well. Thank you very much. So our final speaker, who we can just about see at the very end of this long lineup, is Sophie Medlin, who is a consultant dietitian. Your introduction to yourself is far more fabulous than mine, so we'll stick with that. But Sophie, I mean, you see patients for varying issues. I mean, you see sort of irritable bowel syndrome, polycystic ovarian syndrome, you see eating disorders. But how much of a focus is skin management for you in your clinic?
Yeah, good question. I mean, it's obviously everybody has skin, right? So ultimately, lots of my patients may live with disordered eating, complicated relationship with food, and skin problems. Lots of women who have PCOS have skin problems. And then lots of my IBS patients or patients with Crohn's disease, ulcerative colitis, celiac disease comes with skin problems too. So there are lots of gut-skin related conditions that come alongside symptoms and problems. But also, because everyone has skin, lots of people have a skin problem that goes alongside another, perhaps not so related medical condition.
And so many of these skin conditions are rooted ultimately in inflammation as well, aren't they, within the body? I mean, you've got the eczemas and the psoriasis and the, I don't know if that's psoriasis is, I don't know what the plural of that is. The rosaceas, the active acne. I mean, is inflammation really the thing that we need to be looking at when we come to managing skin from your perspective?
Yeah, I think, we don't know all of the answers, I think is a really important thing to say. But as far as we can understand at the moment, where we find this gut-skin axis important is around controlling inflammation. And there might be some of you in the room thinking, well, how can my gut possibly impact my skin? And really it's all down to the compounds that are produced by probiotic bacteria in the gut. So particularly lactobacillus species produce a lot of something called butyrate. And butyrate is a really powerful anti-inflammatory agent that is made in your gut and then travels through to the rest of your body to help to regulate inflammation. And we saw even in COVID times that people who had loads of butyrate production in their gut suffered much less badly with COVID than those who didn't, and we think that's because of its really powerful anti-inflammatory properties that it has. So when we're thinking about these kinds of conditions, we need to be thinking about how we can best harness our gut to try and reduce inflammation across the whole of the body. And of course, diet comes to play in that a little bit as well. And we don't, in my clinical practice, which is very much evidence-based clinical practice, we don't talk about anti-inflammatory diets very much. We don't talk about, what do they call it, the autoimmune protocol diets and things like that. Those are very restrictive and not something we recommend. But of course, there are things that perhaps may encourage more inflammation in the body than things, and there are lots of foods that we can eat that help to discourage inflammation in the body, and mostly that's eating lots of plants, right? So it's always good advice for everybody.
I was going to actually ask you, because I think there are a lot of foods that have a really bad rep when it comes to breakouts and acne, and we always hear about dairy, we hear about sugar, we hear about high GI foods, we hear about whey protein. Are there any are we demonising these foods unnecessarily?
Yeah, but for the vast majority of people, the foods that we cut out actually only serve to end up leaving us more nutritionally compromised than we would have been if we left them in. And our skin is kind of almost like a final thought for our body, right? If we're nutritionally deficient, same as our hair, if we're nutritionally deficient elsewhere in the body, your skin's not going to be prioritised, and actually we need to take care of our entire body. And when we start cutting foods out, particularly whole food groups like dairy, we end up in a more compromised nutritional situation, which can then lead to more problems further down the line. And that's not to say that there's nobody who doesn't benefit from removing dairy from their diet for acne, because I know there are some people who notice a big difference, but that should be treated on an individual level, and it certainly shouldn't be the case that people who have acne are being told by everybody on social media, next door neighbour, mum's friend, to cut out dairy, to cut out sugar, to cut out all of these things. And what we find, sorry Fran, briefly, is what we find to be the case is that when people start to fixate on their food as the root of skin problems, for example, that can lead to this disordered eating, this complicated relationship with food, not going out with your friends, not enjoying things socially, more isolation. And that stress, that anxiety, is also pro-inflammatory in the body, right? And then we can end up in this cycle where things get worse. So ultimately it's a very individual thing, but most importantly it's ideal to go on that journey if you're exploring food triggers with a dietitian who can support you to make sure you're not getting deficient, as well as making sure you're not cutting out things unnecessarily.
I mean, yeah, I totally agree, and there's a lot to unpick there, particularly the sort of disordered eating that we can end up, really fixating on, almost trying to, get back in control of our skin can lead us to try and unnecessarily control so many other areas of our life, which can obviously spiral out of control. It's interesting, and often we have these talks with Beauty Triangle, and we find ourselves sort of saying, well, exactly how do we know? I mean, obviously you know the data inside out for sort of what is nutritionally sound, but for the average consumer who is hearing, cut out dairy, cut out sugar, don't eat chocolate, go low GI, try this, what are the things they need to be doing to actually understand what works better for their body? Does it come down to bloods, understanding better sort of the data of their own sort of physiology?
Yeah, it's really difficult, and what's really difficult for people with skin conditions is because it does take a long time, as we've talked about previously, that 12-week skin cycle. I think when you cut out dairy, you could cut it out for 3 months and see how your skin responds. But what I find is actually lots of people have cut lots of things out of their diet, and I say to them, is your skin any better? And they say, no, not really. But they're still fearful to reintroduce these things. Yeah. So I think it's about doing things on an individual level. Sometimes we do bloods, particularly if people have cut out a lot of things from their diet, because we will be looking for nutritional deficiencies, and we'll look at things on that level. But it is difficult for people to pinpoint. It's difficult for us as clinicians to pinpoint exactly what's driving skin problems. And I would say rarely it's an underlying dietary cause, unless someone has an androgen predominant skin problem. So that might be in PCOS, for example, a hormone issue, where actually lower GI diets and being a bit more cautious with sugars and those sorts of things can make a difference in the long term. But as anybody in this room knows that's tried any sort of dieting for 3 months is actually really hard. And so making those changes very gradually as a lifestyle change and in a non-restrictive way is really important, otherwise it does lead to more problems for people.
I think the small incremental changes, not the sort of quick fad diets and sort of fixes, but I also liked your point that you made earlier about introducing more plants and vegetables, for example. I think sometimes rather than thinking about what we can cut out and eliminate, probably better that we think about what can we get in, and then sort of flip the ratio that way a little bit.
Totally, yeah. And I think it's always, at any type of lifestyle change should be focused on, okay, I'm going to eat more of this stuff, as opposed to less of this stuff.
Yeah.
And what we see from the data is when you focus, for example, on making sure you snack on fruit twice a day, it's just one of those things that you're adding in, but that it generally displaces less healthy snacks. So that's just a small example of how going into the mentality of, I'm going to add more of these things in, generally also displaces things that are less good for us overall and may have improvement in our skin condition.
And that leads us quite nicely onto supplementation, which is actually, when you boil down to it, supplementing the things that are not existing in your diet. And I'm really interested to know from your perspective as a dietitian, do supplements work when it comes to getting our skin under control? There are a lot of products out there, and again, the consumer can sometimes be quite confused about what they should be taking, what's going to make it worse, what's frankly just not even going to make any difference at all.
Yeah, it's really difficult, and I know it's an annoying answer, but I think it's very individual. There's certainly no one supplement that or nutrient that people are supplementing that they're going, okay, this will solve everyone's problems, right? And that's why I think it's so individual, because it will depend on what you're eating regularly, what you're not having so much of, what your diet's limited by for religious reasons, cultural reasons, whatever else it might be involved in your life as an individual. But we think that being well nourished is a really good route to having healthy skin. And so ultimately that's where supplements can play a role. And what we see is that people live busy lives, people are on the go, we live in very polluted areas. Often we're grabbing food on the go that may not be as nourishing as we'd like it to be, or as high in vitamins and minerals as we'd like it to be. And that's where sometimes having a safety net of a good quality multivitamin can actually really help with some of these things and fill in some of those gaps that you perhaps don't know are there. That can also potentially help to improve your sleep and things that can make a big difference to your skin health as well. And I think antioxidants is one of those places that we can look to, particularly for skin health, to try and consider whether they could be a route to trying to improve our overall skin health, but our general health as well.
It's sort of not just looking at the skin as an individual organ and recognising that it covers our entire body, but actually it's connected to absolutely everything. Going back to your sort of comment about the skin-gut axis, I actually think it's really refreshing to almost have these terms, as much as they feel a bit sort of trendy and sort of buzzwordy. They do actually remind us that the human body is completely connected. Every system has a knock-on impact on another system. And going back to the gut-skin axis, can you tell us a little bit about probiotics and where those fit in? Because evidently that is something that really does have the data to support it.
Yeah, absolutely. I think it's a really exciting area. I think it's something we're learning lots about. And again, mechanistically, to the best of our knowledge at the moment, it's very much probiotics being used to drive down inflammation in the whole body through the increased production of compounds like butyrate and butyrate itself, which help to regulate inflammation. And I was lucky enough to develop the You're Looking Well supplements, so I formulated those. They're in your goodie bags today. And of course, in that journey, I did loads of research into the gut-skin axis and also into supplements and nutrients that can support skin as a whole. And there is great data for some of the probiotic strains that are in that product in supporting not only acne management, but also things like rosacea, eczema, skin aging. These sorts of, some of these things are a little bit, what's the right word? A bit spurious, because I might say, oh yeah, I think my skin does look a bit less old today, and some of that's self-reported, whereas some of the stuff like acne, eczema, rosacea is a little bit more black and white. You can say for sure, yeah, things are better or worse. I think we've got a long way to go in terms of understanding the gut-skin axis, and where that research is going to go, I think is really exciting. But the products are there and they're available, and I think it's worth people experimenting with them if it's something you've not tried before to support your skin.
What are the things that we should be looking for in a probiotic at the sort of bare minimum if we're looking to support our skin better?
Yeah, this is one of my favourite topics. So not only just for skin probiotics, but for all probiotics, it's really important to have a probiotic that's in a delayed release capsule. And that's because your your stomach acid is very strong. It's designed to kill bacteria. And some testing I've done, not with You're Looking Well, with another company I formulate with, has shown that it's not in a delayed release capsule. It's very unlikely to get to the gut alive and do anything particularly useful for you. So you want to be looking for a delayed release capsule. For those of you who have existing gut symptoms, bloating, gas, changes in your digestion, you really want one that doesn't have a prebiotic, because the prebiotic is usually the thing in a probiotic that people say to me, I've tried probiotics, it made it worse. It's usually because you've tried ones with a prebiotic in them. Prebiotics are fermentable carbohydrates. They're useful, they're important, but lots of people who have IBS type symptoms are not very tolerant of them. And there's one in particular called inulin, which they put into all gut health products, and it makes everybody bloated and uncomfortable. I definitely don't have IBS, but if I eat these products with inulin in, I'm uncomfortable. So it's worth looking for one without a prebiotic, and you want to make sure that they are using evidence-based strains. And what I mean by that is that some companies will choose, say for example, a lactobacillus strain that's got the same name as one that's used in the research, but it's not the genetically identical strain. So when you're looking at a probiotic label, have a look that it's got a little code after the name of the probiotic, and that means that it's a genetically researched strain from a particular strain bank where it actually had research done on it. I know it's difficult and you don't want to be checking all the labels, but it's really worth doing that little bit of homework just to check. And we want to make sure these probiotics get to your gut alive where they're working and doing their job. If they don't reach your gut, they're not going to be doing anything useful in your body.
But I think that's a really valid point. I mean, you might have to do a little bit more homework, but ultimately it's not time that's going to waste. Getting to know your body a bit better, getting to understand what makes your body work a bit better is probably the best time you'll ever spend, quite frankly.
Yeah, I agree. And there are so many probiotics on the market, so many of them are unfortunately a waste of money, so it's worth doing it, making a little bit of time just to try and research that a bit more.
I think all three of us have touched on the sort of mental health aspect of breakouts, managing skin, getting back in control of our skin. I'm just interested to know, sort of finally from you, Sophie, if there's anyone else that you sort of ever sort of advise patients to include in their support networks. I do sometimes think that acne management is a bit of a team approach, as a team support, and that's, to go back to sort of the philosophy behind the events we do here, is because I think all of these different specialisms all combine together to really get, a brilliant end result. So who do you sort of involve in that breakout journey?
Yeah, absolutely. So anyone who's struggling with their skin, Anjali's a good friend and colleague of mine, so we send people her way, Anjali sends patients our way, and Anjali's got an amazing psychologist on the team, and I think that psychology piece is a really important thing for people to understand how much of an impact it's playing on your life. And skin problems are a bit like gut problems in that they can stop you from doing things and enjoying your life, as we've mentioned, and sometimes they do go hand in hand. So actually being able to work with a psychologist to help you to open up your world again, hopefully open up your diet again alongside myself to make sure you're not restricting unnecessarily and giving yourself long-term problems is such an important thing. So my kind of key team for skin problems is obviously dermatology. Sometimes we'll involve GPs and write to the GP for basic things, but dermatology and psychology for skin problems.
I love that. I think just having the conversations, having all of these debates out loud and actually sharing the information is the most important thing. Break down those barriers and destigmatise the conversation. Sophie, that was really, really interesting. Thank you. And I'm really looking forward to trying that probiotic that you have created and formulated. It will be in your bags for everyone. That brings us to the end of tonight's panel discussion. So a big thank you for being with us. And I think what I found so interesting is listening to each of you, because it goes to show there is no silver bullet. I think each of you really emphasised the importance of time, whatever skin journey we're on, whether it is breakouts, whether it's managing age, whether it's better understanding the connection between our skin and our gut. But I think you also really beautifully, all of you, underline the importance of having some self-compassion as well, and really just, I suppose, like prioritising ourselves and our mental well-being and ensuring that this is something that doesn't disrupt our life endlessly, and I suppose really empowering us with the solutions that can prevent us from going down that line. We do have time for a few audience Q&As if anybody has questions. If you do need to leave, then please do drop off your referral cards and don't forget to pick up your goodie bag as well. Are there any questions? Sadie here.
Hi, I had a question about the AviClear. Really fascinating that it shrinks the sebaceous gland. I wondered, is there a negative impact on the acid mantle, or is it actually good and it reduces shine because you're overproducing oil anyway?
Yeah, so if you think about it, most people who are acne prone, there is an excess of oil production.
Yeah.
So ultimately what you do is, this is a non-ablative laser, so it does nothing to the surface of the skin or your epidermis, so it doesn't do anything like create a wound. It's going deeper into the skin. So it will reduce that shine that you're talking about. So it's good for people that have got oily skin but aren't necessarily covered in loads and loads of spots.
Yeah, okay, thank you.
And just following on from that, I mean, is there any, is there any negative connotation of down-regulating sebum as well in terms of like dehydration and causing fine lines and wrinkles that maybe wouldn't have been there otherwise?
Do you know, that was one of my first thoughts as well when I first heard about AviClear. Is there going to be some kind of negative impact on skin aging, for example, because as we get older, our oil glands do get smaller. But again, it's going back to the underlying pathology of acne itself. One of the issues is there is excess oil production to begin with. So what you're essentially trying to do is always create a profile in the skin which mimics more of a non-acne profile, because you're down-regulating these oil glands. So you wouldn't expect that.
You're so right, because you're addressing the excess. It's always the similar question that people say, if I have toxin injected into my sort of armpits or something, will I stop sweating everywhere? And they get very stressed by it, but actually you're just taking away the excess.
What age you use it on?
So you can use it pretty much at any age. If there is active acne there, I wouldn't say age is the restriction. From a practical point of view, I think the oldest person that we've treated in clinic is somebody who is currently going through the later stages of menopause, and the youngest is a teenager.
Are there any other questions?
What would you define as acne? So a teenager going through puberty, is it just a group of spots in one area?
So, acne really is like just the medical word for spots, and it's completely normal for teenagers to go through a period of spots. But if you saw a dermatologist, we would label it as acne because that's just a medical descriptive term. From a practical point of view, the primary acne lesion where acne develops from is comedones, so little block pores basically, so your blackheads and your whiteheads. So when you see a teenager, normally the first thing that you notice is that oil production goes up. The next step that we normally see as they get a little bit older is they start to get the little bumps underneath the skin, so they start to get the texture. So that's where the comedones then develop. And then left unchecked, so those comedones still count as acne, the oily skin doesn't. But if left alone, those comedones, because they are the primary acne lesion, can then develop into inflammatory acne. So that's where you can then get the pustules and the papules, the little like kind of white bumps and the red bumps. And then as acne progresses, for some people, that's where you will then get the deeper nodules and cysts. So they're the big, plump, juicy ones underneath the surface. They don't really come to a head, but they're super painful. and they just last for a long time. So normally, one person who's got acne might have a combination of those acne lesion types. They might have a couple of comedones, a couple of inflammatory spots, maybe the odd nodule, odd cyst. But essentially, to go back to it, I know we don't think of blackheads as acne, but it is a form of what we call comedonal acne as a dermatologist purist, however label it.
That was very interesting. Is there another question?
Hi, I'm Sophie. So thank you everyone. It's really interesting that you can talk. If you've had your blood stuff and everything's okay, would you still recommend taking supplements?
Yeah, great question. I mean, it depends really on your lifestyle and what you're doing and what you're eating and what you're not eating. I think if you, never does a blood panel, particularly an NHS blood panel, include every nutrient under the sun, right? So we would still have a good conversation about what you're eating, what you're not eating so regularly, what you might need. Common supplements that people benefit from are things like omega-3s, usually from algae is safer, and that's like a long-term investment in your brain health and your mental health and things like that. So there are things that are a good investment even though you might not be currently deficient or within the realms of what we would call deficiency. But there's no reason if you're eating a well-balanced diet, getting everything you need from your diet, to think about supplementation unless there's a particular problem you might like to address. And sometimes you might have a symptom that could be related to nutrition. Say, for example, brain fog is a really common one, right? Or lack of sleep. These kinds of things that are not annoying enough maybe to go to a doctor about, but are bothering you day to day, that nutrition might make, or supplements I should say, might make a difference with. And there are some super safe supplements like omega-3s and B vitamins and things like that, they're water soluble. So omega-3s is a bit different, but they're water soluble. So you can try them for a month, and if you feel better, great, fine, keep taking them. But actually, then there's no risk to taking them, if that makes sense. But I worry more about the people who come to me with a long list of supplements they're taking than the people that come to me with no supplements at all.
I definitely fall into the latter camp about nothing, which is terrible.
I was going to say about your, how about you taking kefir? Who's wrong that? Do you still need to take probiotics?
Yeah, good question.
Is it better to sort of have a natural
Supplement it through
fermented
food before.
Yeah.
and then rather than use
Yeah, I love
your
this.
tablets got fillers in?
Yeah. So kefir is great. So of all the fermented foods, including kombucha and kimchi and all of these nice ones, there are lots on the market at the moment that's super trendy, but actually kefir is the only one that has proof that any of the bacteria actually impact your gut microbiome. Now, you have an oral microbiome and you have an esophageal microbiome, so having kombucha, having kimchi, having the other fermented foods is still useful for you. It's not a bad thing, and you probably are getting some health benefits, but at the end of the day, I'm really confused now between kimchi and kefir. Kefir is the only one that has proven gut health benefits. Now, the strains that are in kefir are pretty limited, so you're only getting very particular strains. And if you're trying to target something like the skin, they're not necessarily the strains that are going to benefit your skin. Those are the ones that are in probiotic capsules and again in a delayed release. And yeah, I mean, we do worry a little bit about artificial fillers and all these kinds of things that are in probiotics and things like that. But actually, if you're trying to have a targeted benefit of something you're specifically seeking, then having a capsule-based probiotic is more likely to be a benefit than a sort of scattergun approach of using fermented foods, if that makes sense. Still great. I have kefir all the time. I love it, but it's not the targeted golden solution that's perhaps marketed to.
What would be complete? That's what I would recommend, because we have a kefir at home, so
Yeah.
you just want to
Biotable.
Yeah, that's the.
Yeah.
So which would be complete in your opinion?
There isn't anything. There's no capsule, there's no probiotic, there's no probiotic drink or anything like that. It's got all the strains of probiotic bacteria in it. It's just, there's so
You
many.
develop that for us, possibly.
I'm a bit busy, but maybe.
Seeing a gap in the market.
Yeah. But actually, I think, it's about, we're now kind of beyond this world where we just say, this is for your gut health, into, this one's specifically for bloating, this one's for constipation, this one's for our gut skin axis, this one's for our brain health. So actually, if you're targeting a specific symptom, you want to be using a probiotic that's got evidence for that specific symptom, as opposed to saying this is kind of scattergun for gut health. Does that make sense?
Yeah.
Beauty behind as well.
Would you know what would be the major difference in bacteria, whether you're having dairy kefir or coconut kefir and water kefir?
Great question. So unfortunately, we think it's the protein complex in the dairy specifically, and potentially some of the minerals that are in there, that wrap up the probiotic bacteria and protect them from your stomach acid. So no one's done any trials on water kefir or coconut kefir or any of these other types of kefir, or even the plant-based kefir, any of the plant-based kefirs, let's say. So we don't know is the answer, but it would be, in my opinion, it would be very unlikely that any of them get to the gut alive. But again, we've got an oral microbiome, we've got an esophageal microbiome. It's not that they're to be thrown out completely, it's just that the dairy kefir we know does make an impact because of the mineral matrix and the proteins that protect it.
So I've previously been on antibiotics for acne and it didn't work, and they're going to put me on a new one, but when I had the previous one it made me feel very sick and like bloated and so on. So do you have any tips for like maybe food or particular probiotics I should try to make that process a little bit easier?
Yeah, I think anyone who's taking antibiotics should take a probiotic at the same time, and lots of GPs are recommending that now, which is great. So Holland and Barrett have a good probiotic in a delayed release capsule. That one is called, I think it's called a tribiotic complex. It's got the kiwi fibre enzyme in it, and that's a particularly good one for constipation and bloating. Then the ones that I designed, which are particularly good for mental health, anxiety, and reducing cortisol, that sort of thing, they're from a company called Heights. The ones you've got at the back here, they're from You're Looking Well, and those are also in delayed release capsule. And those ones are particularly good for skin stuff. So I would say for you going through that kind of skin journey and using antibiotics for that, those would be a good choice to use.
Also, there's a company called One Nutrition, and everything's supposed to be food-based, so everything's food grown. So, what are your thoughts on that company?
I think Wild Nutrition have a place in the world. I worry about, they sort of have caveats on their labels of things like, this is roughly what this contains, which is all well and good for just general health, but if you're a woman who is pregnant and you want to get definitely enough folic acid, for example, we want to be a bit more specific than that. I think Wild Nutrition I think they're doing a great job and their marketing is amazing and all that stuff, but I think as someone who needs to be precise in my work, they're perhaps not my first choice.
So is there not some research then?
There's one question down there. Yes, please.
I was going to say, we talk about like the acne for the face area. What happens if it's on the back? So the same thing apply if it's on the back, or what would you suggest, like for the back?
In terms of taking one of the probiotics, yeah. I mean, would it be sort of a similar approach as for the face? Same principle, yes. Questions? I think all of our speakers will be around for a little bit longer, so if there are any things that you don't want to put your hand up and talk about out loud, totally get it and you can grab them afterwards. But yeah, a very big thank you for joining us today, and most importantly, a huge thank you to our amazing speakers. Don't forget your goodie bags, because it's really the route to getting everything skin-related under control as soon as you get home. And yeah, we'd love to see you again at future talks and festivals and whatnot, so please sign up to our mailing list if you're not already on it. It's thebeautytriangle.com. Thank you.
Thank you.